Hi, my name is Bianca Powell Turner, and today I'll be talking about telehealth. Telehealth is a broad term that entails different technologies and tools to bring forth virtual medical and healthcare services. Telehealth is not an exact service per se, but rather a variety of services to strengthen and enhance healthcare delivery. Basically, telehealth allows an individual to better manage how they receive care. Telehealth could be utilized through a variety of approaches. The first and most common in recent times is the mobile device, such as iPhone, smartphone, Android, anything of that nature. The benefit of using a mobile device to access care is that it is quick, efficient, and can be managed from home. Not only are telehealth tactics used by patients, but they are also used by medical care providers. Healthcare providers such as doctors, nurses, physicians, and more are able to use the tools to deliver better services. Some examples of ways telehealth can be used by patients include using a mobile device or tablet to view or upload medications or prescriptions, using mobile applications created by the medical facility are very efficient for patients to check their test or lab results. Another usage would be checking the availability of appointments or actually scheduling appointments online. By doing so, patients will be able to bypass long wait times over the phone and bypass menu options that could potentially slow down getting in contact with medical care personnel. Some of the main goals of telehealth include increasing productivity and expediting services to patients. Another goal is accommodating those in rural areas or those of which have limited access to health care. Another objective of telehealth is strengthening communications among the patient and the healthcare provider. Some ethical considerations to make in relation to telehealth is the possible lack of face-to-face contact that may potentially come with telehealth. With such advances in the digital age, people may opt out of actually going into a medical facility. The issue with this is that the physician may never see the patient, and it affects the decision making when it comes to diagnosis. This could ultimately hinder the patient, medical provider, or doctor relationship. Another ethical consideration is patient privacy. According to an article by Shivanjay Manta, there's a possibility that patient confidence in healthcare providers can be compromised. With having such a heavy dependence on the digital and electronic communications, patients may never know who they're coming in contact with. This could also spark issues in relation to where the information is going and who is actually handling the information. Also, this could affect how information is being shared, for example, social security numbers or actual diagnosis. With the rise of security breaches, many patients may become apprehensive to such telehealth practices. The last ethical consideration is that new is not always the best option. Because the implementation of new technologies and applications are so new in many settings, people automatically assume that this is a better approach. The problem with such drastic changes in this technological realm is that quality of care could potentially be harmed. Menta also mentions that with any new drug or new device, careful evaluation must be conducted and assessed for errors or for possible improvements. Telehealth raises a variety of legal concerns. The first legal concern is confidentiality and privacy. Because of potential issues with the safeguarding of vital patient information, providers are required to comply with the same standards as the Health Insurance Portability and Accountability Act, also known as HIPAA. According to telehealth resource centers, all telehealth programs should provide a risk assessment with respect to data transmission consent and HIPAA security policies. Another associated regulation is medical malpractice and liability. According to the Telehealth Resource Center, it is important to check with your malpractice insurance provider to see if there are any requirements or limitations to the provision of telehealth services under the insurance policy. Basically, patients utilizing telehealth tools must be sure that they're being covered. Telehealth has a huge impact on healthcare delivery. Telehealth commits to greatly combating some of the most challenging issues in the healthcare system. Some of the issues include the cost of care and the accessibility of care. With telehealth and telemedicine, patients are able to receive clinical services and most emergency and intensive care services. According to the California Telehealth Research Center, patients diagnosed and treated early often have improved outcomes and less costly treatments. Patients with telehealth-supported ICUs have substantially reduced mortality rates, reduced complications, and reduced hospital stays. Also, telehealth improves support for patients and families. Patients can stay in their local communities and, when hospitalized away from home, can keep in contact with family and friends. Most telehealth applications empower patients to play an active role in their health care. According to an article by Michael J. Ackerman, key drivers for these tools and technologies are the need and interest to collaborate among telehealth stakeholders, including patients, patient communities, research funders, researchers, healthcare service providers, professional societies, industry, healthcare management, economists, and healthcare policymakers. Telehealth tools and technologies provide a bigger picture of the patient and what they need specifically. Ackerman also states next-generation tools and technologies are vehicles toward personalized medicine, extending the telemedicine model to include cell phones and internet-based telecommunications, tools for remote and home health management with video assessment, remote bedside monitoring, patient-specific care tools, patient electronic profile, and physician note writing capabilities. Telehealth is being implemented in rural healthcare settings in lieu of the Rural Health Information Hub. The great thing about telehealth is that it has the potential to spread to rural and isolated areas. This helps decrease the burden and hardship for patients that have to travel great distances to receive specialty care. This also aids in communication and timeliness of services. This concludes my brief on telehealth. Thank you.